Hi friends, welcome for today's session, NABH 6th edition, SS Assessment Continuity Chapter, 3rd Standard. It states that there is an appropriate mechanism for transfer or in or out and referral of the patient. It is having the four objective element. First is the transfer in of the patient to the organization is done appropriately. Second is the out and referral to the another facility is done appropriately. Third is the during transfer or referral, staff should be accompanied as per the clinical condition of the patient. And fourth objective element is stating you should give a discharge summary to the patient who is discharging from the hospital to the another hospital, or you should give one transfer summary whenever you are transferring to the patient to other organization for any diagnostic purpose or any patient is discharged against medical advice. So let us see one by one what is the transfer in of the patient. Transfer in, the appropriate transfer will be defined as if you are receiving the patient, then you should have a proper facility, diagnostic facility, treatment facility to treat the patient, to save the patient. Then only you should accept the transfer of the patient from other organization. Whenever you are accepting the transfer of the organization, you should see the patient condition, patient requirement, and you should ask the hospital about the complete copy of the patient record, such as discharge summary, any diagnostics they have done or anything, any test they have done, then that they should provide. And as per the requirement, you accept the transfer, then you receive the patient with the proper transportation equipment, and you take the patient and you scrutinize the patient. Whenever you are taking the patient from the other organization, transfer policy should be followed. And you should have the policy for the planned transfer and unplanned transfer as well. Organizations should have policy for the planned transfer and unplanned transfer. Unplanned transfer is any roadside accident, any suspected unstable patient transfer, like anyone has fell down in their home and they have called, and they required the ambulance and they want to shift the patient to your hospital. Then in that case, you should take the detail of the patient, and then you decide that which staff should go with the. So one trained person should accompany it with the ambulance, whoever has trained in the ACLS, trauma care and all, because whenever they are going to receive the patient, they can treat the patient there, they can give the emergency treatment, and wherever required, doctor also will accompany it in the ambulance. And the planned and referral cases of the organization should provide the feedback to the referral organization about the patient condition. When you have received the patient to your organization, after scrutinizing the patient, after admitting the patient, you should give a feedback to the referral organization about the patient condition. Transfer out or referral. In this, the requirement is policy of transfer out should include the service unavailability and diagnostic test. Wherever you are in your policy, you should mention that these are the services where your organization is not providing, or these are the tests like PET CT scan every organization is not having, your neurosurgery or cardiac surgery, cath lab every organization is not having. So in that cases, you can mention in your policy these are the unavailability of the services, and these are the diagnostics test is unavailable in the hospital. So we are referring the patient, we are transferring the patient to out. And for every transfer out of the patient due to unavailability of services, patient family members should be counseled on this. And before transferring out the patient should stabilize before shifting. Proper ambulance and equipment should be arranged for shifting. Other organizations should be informed and checked about the availability of the services and availability of the bed before shifting. Okay, so you have to follow the referral, and you have to follow the transfer out criterias. And during the transfer out, your ambulance should be properly equipped and proper staff should be there. What is the staff requirement? Staff requirement is the staff should be trained in the trauma and or emergency staff nurse should train in the ACLS will be accompanied in the ambulance. Staff should be trained on the transfer policy, and in case of unstable patient, the doctor will be accompanied with the patient. This is the requirement of staff during the transfer in or out or referral of the patient. What is the patient will take from the hospital or patient will receive during the transfer? Any transfer out of the patient should take the summary, transfer out summary, which include the patient condition at the time of arrival, whatever the treatment given, whatever the investigation you have done, and patient condition during the transfer, or whatever the investigation done, that report also to be given to the organization where you are transferring out with the transfer out summary. In if any patient is getting discharged from the hospital or transferring out due to unavailability of the services, then discharge summary should be given to that patient. If the patient is taking discharge against medical advice, through that patient also you should provide the discharge summary, and a copy of discharge summary to be retained by the organization. During the transfer, patient condition should be monitored and documented in the transfer form. This is the transfer form, patient transfer form, where you should write the patient detail, UHID, primary consultant name, and if the primary consultant have you informed or not, date and time of transfer. If it is MLC case, then MLC number also should be mentioned. Then region of transfer should be mentioned, to where you are transferring, that should be mentioned, and your before shifting vital, during shifting vitals, and after receiving vitals should be written. Then you should then whatever treatment given or advised, any equipment support is required, any ventilator support or oxygen support, then mode of transportation should be written, then staff who is accompanied, then doctor's name and employee ID, staff name and employee ID should be there, then any reports, then here you should write. So this is the patient transfer form. Thank you. If more information required on the transfer in or transfer out or any referral, then please comment in the comment box, or any suggestion you want to make, please comment in the comment box. Thank you. If you like, please subscribe my channel.